be able to house up to 4,000 beds.
Now, Dr. Kunal Patel is a dentist and has volunteered to help out along with his entire practice, and he joins us now. Dr. Patel, thank you very much for talking. It's lovely to see a smiley face this morning. Tell us.
Hello, good morning.
Good morning. You got the call, you heard the dubbed Nightingale Hospital being opened. What's happening?
So, 2 weeks ago, me and my team at Love Teeth Dental, we decided to put our drills down because, unfortunately, our governing bodies and the guidance wasn't there for us. But as a dental community, we quite early on recognised that our PPE and our, more or less, the aerosols that we would create from our treatments was endangering and passing on the COVID virus. You know, it wasn't what we needed to happen at that point in time. So a couple of weeks ago, me and my team at Love Teeth, we decided to put our drills down, and unfortunately we had to step away from treating our patients. Luckily this week, the chief dental officers come out and shut down all dental practices across the country for the safety of not transmitting COVID-19. So it's been a great effort, and it was a sad time for us in the clinic because, you know, we're used to helping people and we just felt as if we weren't able to do our part for the NHS. But luckily enough, we've been able to volunteer over the last few days to help the wider NHS. And what's that's involved is, first of all, obviously, we've shut down our clinic, so we needed to make sure there was something in place to treat millions of patients, because as you can probably imagine, we can't really treat acute tooth pain with a phone, and that's all we're allowed to do at the moment. So luckily enough, we're able to help by being able to offer our clinic as an urgent dental care centre.
So to be clear, so you will be in the hospital but still working as a dentist for emergency cases?
No, so I believe there's three aspects of volunteering. I think the first one we've been able to do is volunteer our clinics as urgent dental care centres. And I think they'll be located locally in our areas. And if our clinic is luckily to be selected, I believe our team will be one of the chosen teams in the area to treat acute dental pain. We were also yesterday asked by the NHS to tell them a stock count of which PPE we had available to us, such as masks, gloves. So I presume if we're not chosen to be an urgent dental care centre, we will be offering our PPE equipment to either Nightingale Hospital or these centres. And lastly, we were able to yesterday officially volunteer the entire team, from dental nurses to receptionists to therapists to dentists, for the Nightingale Centre. Now, they did allow us to sort of, because our skills are all going to vary from my dental team, as you can imagine. So we were able to volunteer if we wanted face-to-face, or if we wanted to prefer only being, you know, over the telephone care. So this has been made available to us. We are able to volunteer. I mean, I was so proud of my dental team when they actually all said, yes, I want to volunteer, because it shows that great community support. And we know what a tough time our medics are having on the front line on the NHS, because we have so many colleagues intervene, and they're saying, you know, as long as the correct PPE will be available, which, you know, obviously resulted in our dental clinic shutting, but I'm hoping, we can only hope that the Nightingale Centre and everything else, the NHS has enough PPE to, you know, recruit me and my team in, because obviously, safety is first. We're not going to battle COVID by spreading the virus anymore. PPE is going to be essential in this. As long as we have it, we're all hands in. You know,
Okay.
my team are ready to go. But obviously, I'm sure they do.
OK. Well, look, Dr. Kunal Patel, thanks very much for talking to us and telling us your situation. Obviously, if you are chosen and you do work at the Excel Centre, the Nightingale Hospital, come back and tell us what it's like.
No,
and what's going
I
on.
will.
Thanks very much.
You know, we're looking forward to helping, you know, the rest of the NHS.
Thank you. It's a good sentiment. Thanks
Thank you.
very much.
Let's take a moment this morning, Saturday morning, 7:46. Matt